So we actually got close to 3,500, I think it's 3,400 qualified ex-NHS members of staff in 1 month. And we screened around 1,500 in 3 days. And then we also worked with the Nightingale. We got 3,800 clinical and non-clinical applicants in 8 days.
So collaboration and doing things differently. These are some of the key ingredients to attracting and retaining talent in health and social care. So we're absolutely delighted to have Clive Meyers with us today. And Clive, I met Clive at RecFest, Recruitment Festival in the summertime, and he was on stage talking about the work that he and Indeed did with the NHS. And he had NHS workers up on stage with them as well. And it was amazing. The passion coming from that stage was just awesome. So we just had to get Clive onto the podcast. How you doing, Clive?
Very well, thanks. A lot colder than I was back in RecFest.
It was a bit. There was shorts, sun, t-shirt.
It was quite a bit, wasn't it? Yeah.
Very different day there.
It was, but yeah. Thanks for coming.
Thanks for having me.
Let's dive straight into it. Tell us a bit about yourself.
Yeah, definitely. Well, thanks for having me, both of you. So my name's Clive Meyers. I'm got a bit of a long job title. So I'm the Director of Public Sector Strategy for EMEA and APAC at Indeed, and I also look after and head up global RFX and bid management. What is that? That
is a long job title.
It is a very long job title. I normally cut out the RFX and bid management bit, but it's definitely worthwhile mentioning. So my role is to help governments across EMEA and APAC make better informed decisions on how to recruit, look at innovative ways and strategies that we can help them.
Okay.
And then also, from a public sector standpoint, we need to be able to bid for that work. So we also help write bids for our sales teams globally. And then also we help the government with data so they can help make policy decisions.
Okay.
Wow. Yeah. Amazing.
What a remit. That's
it's great.
What does it mean to you to do that role?
It means a huge amount to me because we get to make a difference. Like it's really cheesy, right? But our mission statement is we help people get jobs, and we get to do that on a daily basis. It's funny. You speak to any of my family members, you speak to my mother-in-law, for example, or my aunt in South Africa, and she'll tell you I'm a recruitment consultant. And I've never placed someone before in my life. And we wear these t-shirts saying we help people get jobs, and it's very rare we get to see that mission come to life because we're behind a computer and behind a website, a gigantic website where 300 million people a month come to find their next job. But with what we're going to talk about today, we've really got to see our mission come to life over the last 3 years and make a genuine difference. And that's why I love my job today. I'm very lucky in my role that I have a leadership team that allows me to go and do the right thing. That was what I was told to do when I went for this role.
Lovely.
And that's what I get to do. So I love my job.
Oh, brilliant. You can tell by the smile on your face. Absolutely. That's awesome. Love it when I hear that stuff. Going back to when I saw you, give your talk on stage at RecFest, you were talking about that, during COVID, doing some groundbreaking, work for the NHS. So tell us a bit about that. Before that, I suppose you have to go maybe a little bit before that in terms of the kind of the relationship you have had with the NHS and how you started, and then how that kind of came to a peak during COVID.
Yeah, it's an interesting one, isn't it? Because, I'm sure a lot of people watching or listening to this today will have a good understanding of what Indeed is because of who we are. But there are still, lots of people, especially within government, that don't know about Indeed. And, we're just short of 20 years in operation now. And we have been sending millions of applications and therefore making hundreds of thousands of hires each year into government worldwide. But they're just not aware of who we are. And that's what my job is today, is to educate, inform and really get the message out there. So we were doing some brief stuff with the NHS prior to the pandemic, but it hadn't been a real focus of Indeed's. And we wanted to try and help the National Health Service, the largest employer in Europe. And when the pandemic hit, a as an organisation ourselves, we were very quick to work from home. Like we went to working from home in February 2020 before the pandemic had ever really hit the UK. And our business was very, very protective of its employees and wanted to make sure that our health and safety was looked after. So we work for a fantastic organisation that really does put its emphasis on protecting its employees. And as the pandemic was worsening, our CEO, Chris Hyams, reached out to us and said he was chatting with Dave O'Neill, our CFO at the time, and was watching how General Motors in the US was pivoting their mechanics and car engineers to build ventilators.
Oh yes, yeah, I remember that. Goodness.
Yeah, and he rang up and he spoke to our sales leadership in the UK and our UK MD Bill Richards, and he said, we can't build ventilators, but we can help people get jobs. How can we help the National Health Service?
Yep.
And we offered the NHS some significant investment free of charge to see how we could help them in any way. And we didn't have a relationship with them. So in the first instance, we worked with NHS professionals who we did have a relationship with and still got a great relationship with to this day.
Yeah.
On the Nightingale hospitals, like it's staggering now when you think about it. Like if you think 3 years ago, the Excel Centre was a mass hospital.
Yeah, it's crazy.
Thankfully, they never got used, but the NHS did mobilise very quickly to if the pandemic got a lot worse than what it could have been at one point. And we're ready to be able to help and care for people at a mass scale. But if you open a hospital, you need to get people in that hospital, right? So I have got my phone here for stats, just for the record, because I don't want to get the stats wrong.
Yeah, go for it.
But we were tasked with finding people that had worked in the NHS before and getting them back in, because you don't want to rob Peter to pay Paul. So you can't take people out of a trust and move them into a field hospital. So we actually got close to 3,500, I think it was 3,400 qualified ex-NHS members of staff in 1 month. And we screened around 1,500 in 3 days.
Wow, okay.
And then we also worked with the Nightingale. We got 3,800 clinical and non-clinical applicants in 8 days. So we that was basically a use case to show how at scale Indeed can work.
Can I ask you a question on that? So you say you screened them. Was that through the tools that Indeed have got?
It wasn't. It was through an innovative tool at the time, and that was the human being.
Really?
Yeah. So again, where Indeed wanted to help in any way it could, we had a huge global talent acquisition team. Where
so you actually did it.
Wow.
So sorry, this is pretty mad because like I've a relationship with Indeed for years, the industry that I work in and stuff, and work with a lot of clients, speak to a lot of clients who have their own perceptions of Indeed. It's the biggest contributor of job applications and job offers to every company, I would imagine, that I've ever come across. But the perception is not always positive about media in general, because it's like everyone's after the money, after the billings. I didn't know that.
It's massive.
And it's not like, I didn't
brilliant.
know it. But the two things that you just said, like why you love your job and how genuine that is and that kind of stuff. I'm massively into health and social care, hence being part of this. That's amazing.
Yeah, it was pretty amazing. Like, we went into a global hiring freeze because no one knew what the macroeconomic climate was going to be like from COVID. But we didn't furlough one member of staff worldwide. And we had a huge global talent acquisition team who were making hundreds and hundreds of hires because we were growing at a rate of knots to not hiring at all. So these people were available and they wanted to help, like I wanted to help, like Chris Hyams wanted to help. So, normally you get to application stage with most of Indeed's suite of products and it's kind of then over to the employer. But we didn't have, the NHS didn't have the time to screen or schedule interviews for these people or to make sure that they were filtered correctly and had previous NHS experience, etc. So we mobilised the team to help with that. And what that allowed to happen was the NHS to stand up and actually see, right, this is who Indeed is. And that's how we started a wonderful relationship with the nursing directorate of NHS England.
So they weren't using Indeed prior to this?
Some trusts were using us,
but not in total.
Not in a huge way.
That's mad as well.
Yeah.
Isn't it?
But again, there's 220 trusts at NHS England level within 7 different regions.
Yeah.
It's the largest employer in Europe, but each trust does things very differently.
Yeah.
And some of them have brilliant recruitment strategies and do really well, and some we are constantly looking to strive to get better. And I think this is where not spoiler alert for the rest of the podcast, but the collaborative effort as they've moved to more of an ICB, integrated care board way of thinking. And the collaborative effort that these trusts are now working together to make sure that they're all pushing in the same direction has been really refreshing to see.
Yeah, but that's brilliant.
Lovely. One thing, so going back to that talk you gave in the summertime, it really kind of stood out for me is that you were seeing the rollout of vaccination centres around the country, and there you had a thought. You went, something we can do here. So you picked up the phone. And then fairly soon after that, stuff started to happen. So tell us a bit about that.
Yeah, well, just before that, so in the 18 months up to that, we started working on the healthcare support worker program.
Yep.
And we were given 4 key objectives as to working on this program. We wanted to grow the workforce. We wanted to build a talent pipeline so there was less reliance on temporary staffing. Mm-hmm. We wanted to widen access and improve diversity, inclusion and belonging for the NHS. And most importantly, and why they were using Indeed instead of NHS Jobs, for example, is they wanted people that were new to care, that displayed the right values to work in the National Health Service. Because again, from what I mentioned earlier on with the Nightingale stuff, there is no point in stealing a healthcare support worker in social care into the NHS, because all that does is open a vacancy in social care. Yeah. It's exactly the same from trust to trust. So they wanted to get a new to care initiative, and it was working really well. And we were very lucky at the same time, right, from an Indeed perspective in terms of candidate numbers, because so many sectors were completely shut at that time. Yeah. And there was people pivoting from aviation, retail, hospitality, having to find roles in different markets.
Right, yeah, okay.
So we were able to really, really send high level numbers of new to care. And then we had to pivot throughout. We moved to webinars, for example. So we were using Indeed's virtual hiring events to run webinars to inform people about the roles. Yeah. We ran a webinar on World Mental Health Day in 2020. We had over 2,000 people turn up to it.
Brilliant.
And myself and the marketing team actually had 10 questions ready to ask the chief nurse for mental health, and 2 mental health care support workers were on the webinar with myself. Yeah. And we got 10 questions ready just in case there was any awkward moments and no questions.
Yeah, good to have a backup. Yeah.
We had over 1,000 questions.
Yeah.
It was just about engagement. Yeah.
That's great.
And that worked really well. So we were constantly pivoting, and then I was in 2022. I was sat at home one evening watching BBC News, and there was a report on the vaccination centres up and down the country just sat there empty because the vaccine take-up had been so good in this country. Yeah. And naively, I thought that all of these centres and locations had been given maybe free of charge by the organisations that own those venues. Yeah. That definitely wasn't the case. It cost a huge amount of money to the taxpayer for the NHS to have these vaccination centres.
I hate to say it again, but that's mad, isn't it?
Yeah, we've done so much free of charge for them. Yeah. Wow. And I thought, how can we utilise these spaces? And to be honest with you both, in the end, we had to pay for venues because it didn't work out, but that's where the idea came from. And I rang the NHS and I spoke to my contact and I said, what if we could fill these vaccination centres with people, and one day we could educate them about the role, we could interview them about for the role, and we could offer them on the role, and we could do references and right to work checks on the day to really break down the barriers of getting people into the NHS, make it more accessible, but also at the same time hire great people at scale and get them in, and we can zero vacancy rates. Yeah. And I'll be honest with you, this is the Indeed hiring event product that has been running for a few years now. And I didn't expect them to go for it, and I got a call back an hour later saying, right, let's do this.
Yeah.
And it was fantastic. We what I wanted to do was to do this at scale so that we could hire potentially thousands of people in one go, but also maybe change the narrative on how the NHS recruits its entry-level roles like healthcare support workers. And we ran 7 events, and we got to go to some of the most beautiful sports stadia in the country. We did Emirates Old Trafford, we did the home of cricket, Lord's Cricket Ground down the road. But then we also did other places as well, like in Essex. We were in a nightclub that was advertising on its big screens karaoke at the weekend. Barry from EastEnders was coming in and doing karaoke.
I think I've been there actually.
Sounds like your kind of place.
Yeah, it does. So what we did was we wanted to, so we created an event on Indeed for people to RSVP.
Nice.
We then sourced and screened them and made sure that they demonstrated like a first round of screening.
Yeah.
They then arrived on the day, and what we wanted to do about this is we wanted people to be educated and informed before they interviewed.
Yeah.
So the NHS was absolutely fantastic here, and they brought trust colleagues along, still during the pandemic, remember, to be there for an education zone. So a candidate walks in, registers with us, we confirm that they've pre-registered. They then walk through and they meet each of the trusts that are hiring on the day in a collaborative effort. So we would get integrated care boards along with maybe between 5 and 10 trusts, and they would have stands, and they would have nurses, they would have all different types of roles and healthcare support workers there, informing the candidate of what a day in the life of a healthcare support worker is like.
Yeah.
They can ask any questions, they can get more information, and then if they still feel like they want to interview after that point, they can take a ticket and they're next in line for an interview. Some people came in, went to the education zone and realised it wasn't right for them and left, and that's absolutely fine.
What you want, isn't it?
Exactly.
Absolutely.
Exactly. So, I've got the stats here. So from the 7 large events we did, there was 4,768 attendees. A huge amount. There was, from that, 4,564 interviews. So about 300 people came in and went, you know what, this isn't for me, and that's absolutely fine. And from that, we made 3,740 offers across those 7 events.
That's incredible.
Good strike rate, isn't it?
It's great, but that's a great win, and I'm really proud of that, and it's fantastic. But what I'm more proud about is I will be, like last week, where was I? I was travelling to Sheffield for a refugee event with the NHS, and I opened up Twitter, now known as X, and I see a trust is now doing a job, a hiring event for their healthcare support worker positions. Like, it's become a standard way that the NHS now recruits for their healthcare support worker roles.
Brilliant.
So it's really like it's made such a positive change. And it's great to see.
I think that's amazing because, I don't know if I have to tread carefully or not, but normally my experience in terms of media and products, recruitment, advertising, media and products, if there's an opportunity for a company to work out how they work and then buy them on behalf of a client, right? So that's standard, that's how it works. Quite often the people who know how it works are not the people that's selling it necessarily, in my experience. So it's just for you to be able to see now ICBs and other trusts doing what you'd set up and what your team helped with the strategy is amazing. And I suppose, although this isn't an opportunity to sell really, but when you're doing hiring events now to any client, whether it's NHS or another healthcare client, is that support there in terms of this is how you set it up properly, this is best practice, this is what and what not to do? Do you know what I mean? Is that something that you now do on tap, or was that driven by you specifically for the NHS?
That's always been in place.
Has it?
Indeed, yeah. We have a huge sales force based in Dublin and London across national accounts and inside sales, and all of our account managers and national account managers are, fully experienced in hiring events.
Yeah.
We work for a fantastic organisation that's very much wanting us to be client-centric.
Yeah.
And, you know, our mission is to help people get jobs and help the job seeker. And that's what we all strive to do each day. But we also need to put the client at the forefront of our mind as well and make sure that we're delivering. Not every hiring event works. There will be, you know, people that listen to this and maybe they've had a hiring event that didn't get the high level of numbers as it was, and there can be various different issues to that, you know. You know, when we set up a hiring event for the National Health Service, we need to think of some really key things in terms of venue, like easy transport links, accessible. We need to think, you know, what if it rains?
Yeah.
And it really did. Like the first event in Plymouth, there was a storm that had a name after it, and you know, if a storm's got a name after it, it's a fairly big storm.
A bit of rain coming.
And you know, we had about 100 people queuing outside at one point in this storm, and we had to really pivot quickly and make a bigger area inside the place so that we could get more people in. Sorry to give such a long answer there, but yes, the team is there to help provide and support to clients if they want to run a hiring event.
Brilliant.
I think what's really important is what kind of role you're hiring for. And then, you know, we can provide an idea of what kind of RSVP numbers are. We know how many RSVPs it takes to get how many attendees it takes. And so on, and we can then give you an idea of what numbers you need. Yeah,
no, that's brilliant. And I think the long answer is good because that's what people. I think that's really good advice to people. So we did an event once. It was a face-to-face recruitment event, and everything was set in place, but the car park was £3 or £4 to park, and nobody thought about that or checked it. And I guarantee that everybody that day, apart from one person, drove past and went, I'm not paying to park. And it's those little things that sometimes get overlooked. And I know that this is quite granular compared to everything we're talking about, but it is so important because that's, let's say, the difference between success and failure in a campaign. Even if that was a small care company or a small care home or whatever that needs 5 members of staff desperately, then that's massive. Those little details are massive, aren't they?
It's important to dive into the detail, definitely. Yeah. It's good to.
And with the 7 large events, and I'm going to shamelessly plug another organisation here. With the 7 large events, we knew that thousands of RSVPs were going to turn up, and as the stats have shown, that happened. So we've worked with an events organiser who's done some of our client events in the past, like an events organiser called WorldSpan. Because we knew that there was various things that we would have to make sure happens here, like health and safety, the full events management piece, the idea of dealing with huge numbers at scale. And we worked with them, and they were absolutely fantastic in making sure the events ran smoothly. Because I think it's very important, right? When you're coming up with a big idea and you haven't necessarily got all the answers, to get the experts in that have got the answers.
Absolutely agree,
because then that allows us to focus our time on what we can work at, and that is helping people get jobs. So like WorldSpan, you look after the event side of it, you make sure it runs smoothly and work with us. NHS, you make sure that you've got clinical staff there that are able to educate and interview on the day. And indeed, we will power the job seekers, get them ready, and get them briefed on it so that they turn up on the day and want to get that next job.
Amazing. So have you now been able? So you've seen ICBs replicating this, which is amazing. I'm slightly jealous of your job, by the way, but just because of the impact that you've been able to make by having an idea, making a phone call to someone, and it's not as simple as that. Is that person's got to pick up the phone, aren't they? You've got to know who to phone, and then to drive it through is, you know, I doth my cap to you. But you mentioned in your job title that you're a bit of a globetrotter, so you're working in other areas as well. Have you been able to influence what they do in other countries in a similar way?
Work in progress. But in short, yes.
Future episode, Chris.
I think so.
As I mentioned, like, you know, we've just come off the back of a fantastic couple of weeks in Australia. Meeting the Australian government and helping them. But, you know, our team in Australia are already doing amazing things with Te Whatu Ora, for example, who are the New Zealand Health Board. Away from me completely and my team, they've been running hiring events with them for a couple of years now, in other countries, to attract talent to New Zealand, because it's such a small country, and finding healthcare staff, you can imagine what a challenge it is here. It's even more challenging in New Zealand as well. You know, we are very fortunate that we're in 60 countries. We have you know, presence in all of those countries, and we have localized support that are able to help organizations all over the globe in the country that they're in, because you know, what works well for me in the NHS might not work well in Australia, but we've got an Australian team there that is there to guide and support as well.
Amazing. Great stuff.
So going back to the thing about, you know, I suppose this is very much connected with what we're trying to focus on for the podcast, is to address this imbalance of supply versus demand of care talent. We need to look further afield, you know, in terms of the kind of people that we're wanting to hire. People who wouldn't necessarily think about going into care. So, I mean, and this is a challenge facing lots of organisations hiring and care talent. So, what kind of advice would you give them when it's about looking at people who wouldn't traditionally consider a career in care?
I think it's everyone's duty and mine and yours to break down the barriers in getting people hired quicker. Like, you know, we have our CEO, Chris, who I've mentioned already in a podcast, has got a really bold ambition that it should be as easy for somebody to get a job as pressing one button. And that's the ultimate aim. Like, just imagine that.
Yeah.
Because searching for a job is a really stressful thing. I'm really lucky that I've not had to do it in over 7 years now. And it's not nice. You know, we know that long application forms that all organisations struggle with, you know, we need to break them down. We need to try and, from that advertising to hire scale, I see it as 5 buckets, and there's probably a lot more. But if we have advertising, application, interview, offer, hire, how can we, without losing the quality element, because that's super important, break those down to make it as easy as possible to get into their next job?
Yeah.
And that's something that I think we should all be thinking about. And that's why the hiring events, for example, were really successful, because we educated them. So we got a higher quality of applicant coming and interviewing because they had a good understanding of the role, whether that be via a webinar or the actual on-the-day in-person event. We interviewed and we offered on the day, instead of, you know, a selection panel and then saying, "I'll come back another time." You know, these entry-level roles within healthcare, they're not just competing against other healthcare, they're competing against logistics, they're competing against retail,
the
hospitality,
local
pubs, who can offer a job on the spot if you go in there for the same salary.
Exactly.
So we wanted to break that down and give them an offer on the spot, because we all love positive affirmation, right?
Yeah.
You get a job offer. Like, we came up with an idea that once they got a job, we had an "I got the job" placard and asked them if they wanted to have their photo.
I've seen the pictures. Yeah, lovely.
And it was just such a great vibe. Like, it was really seeing the mission come to life. I hate the word vibe. I can't believe I just used it, but it was.
It's true.
And the ability to have HR colleagues from NHS there as well, to capture ID and references, because that's such a long part of the hiring process. If you think, can you send over 2 forms of ID? Or one of those isn't scanned properly, can you resend them, etc. Your references haven't come back, you know, or can we have your references and there's a telephone number that's wrongly written, or etc. It can really, really make the process longer. So having that on the day as well, so that we could capture all that information. The HR teams then had all of that information ready to go back to their trusts after the event and start that process, really help count that down. And I think, you know, as I mentioned at the start, when we first started this program, we were asked to widen access and support diversity more. And I'll give you some stats here, which I definitely want to get right, so I'm going to look at my phone. We wanted to have more ethnic minorities in the NHS. That was what they wanted. So 84% of people that came to those events identified as Asian or Asian British, which was huge. And also, the workforce is very much female dominated within healthcare support workers. So currently, or at that time, only 19% of healthcare support workers were male.
Right.
43% of the attendees identified as male.
That's brilliant. That's really good.
And I think, again, that is just because it's that human element, that human touch. Also, we have to understand that it was also very much right place, right time as well. One of the reasons why I was really pushing to do in-person events was we'd all been locked up for 18 months. Like, it was crazy, right? We all look back one day into our grandchildren or great-grandchildren. There was a time when we were told by the British government that we weren't allowed to leave our house. Like, it's crazy when you say that out loud now.
Totally.
And it was a really great time because people were sick and tired of speaking to a screen, speaking to a chatbot where they didn't hear anything back, speaking to an automated email. That ability to turn up and have that one-on-one conversation with a trust colleague who's working in a job that you are aspiring to work for. It's really cool,
amazing.
right?
Amazing, yeah.
And then the chance to go and sit down and speak to 2 trust colleagues. And, you know, we had great support from NHS England. They were and they still are such a wonderful partner.
Yeah.
For 2 of the events, we had the Deputy Chief Nurse of NHS England sat there interviewing all day.
That's amazing.
Like, candidates didn't realise that, but you had Duncan Burton, who's the Deputy Chief Nurse of NHS England, sat there interviewing wonderful people and offering them jobs for those trusts.
Yeah.
That kind of gesture is extremely powerful.
It's
isn't
great.
it?
So good.
Yeah.
I think so. What I was going to say, when you talk about your chief exec's vision of one click right the way through. So obviously, Indeed's famous for one click apply, right? And you speak to some people who go, oh, well, that means that candidates can go apply for 20 jobs, and they don't know what they're applying for. And you get some employees who go, yeah, well, that's for that reason. That's why we want the cover letter and the application form filling out. And in fact, we were on a panel once talking about this with students because that's the market, right? That's the way it goes. So it's not the candidates need to change or the tech's already changed, but it's everything else that needs to change with it. So if you can then stream, because I think you said 5 sections, I quite often talk about it is in 8, and it really doesn't matter. But when you review those different parts of the process, you can draw red rings round all the candidate dropout, couldn't you? And all the opportunities to engage with a candidate. And then suddenly, with most companies, you suddenly take that candidate out of that system and then you put them into this one. So if you could get a situation where you could basically click and that just carries through all the way and the engagement is automated, it's on one platform, that would be pretty amazing. I suppose the question for me comes, what about those positions that are really, really, really difficult to fill?
Yeah.
And so you couldn't do a hiring event for them.
Yeah.
But then that is the market, isn't it?
No, 100%. It's the market. And so I was just about to say, I completely agree with what you said. For me, there isn't a one-size-fits-all approach.
Yeah.
And I don't think that the hiring process for a Band 2 or Band 3 healthcare support worker should be the same as a Band 9 or Band 10 role.
Yeah.
I think the application process will have to be different.
Yep.
I think the number of stages of interviews would have to be different. But it shouldn't be the same.
Yeah.
That's for sure. And once again, I think for the roles that are the higher volume in this country, there are things that we could all be doing to make it better to get these people into the roles quicker. And we wouldn't have such a vacancy shortage with organisations if we were to be able to fill them quicker.
Yeah.
And this isn't the NHS, but there's other organisations that I know through these events where we were speaking to candidates and getting their feedback, where they had an application outstanding so long with an organisation, they got hired into another job, left that job, and then went into that job that they still had the application open with, and they'd actually had a whole employment with another organisation whilst waiting for that application to go through.
Yeah, definitely. And the bad thing is that doesn't surprise me.
No,
because I've seen, could go on about this forever, but it is really interesting. I was going to say something else then as well. What I was going to say to you was, I was going to ask you if you think there's a difference in the different regions in the UK in the way, the market is in the way things work, because I think there is. Obviously, London's different to, up north kind of thing. But if you looked at the different kind of regions, and I'll actually ask you the question now, do you think there's a difference? And from an Indeed point of view, what have you done or what do you do to kind of cater for that?
There's 100% a difference.
Yeah.
There's a difference from an affluence perspective in some regions.
Yeah.
Like you have really affluent areas which isn't necessarily able to live a life that you can, like, in some affluent areas with the kind of pay that you're getting for an entry level role. Yeah. So it's very difficult to find those people in those areas, and you have to use really innovative ways. And sometimes also Indeed is not the best in those areas. And, we're very much lucky that we are a data company that happens to be in recruitment. We have really great economic labour dynamic data. We have the hiring insights data, which is available for any employer to use. And we can really get an understanding before we put any kind of sponsored job campaign live, whether it's going to work or not. And that's just very quickly at the start of it, before the events, etc. We were running sponsored jobs campaigns, which is what you would probably call our bread and butter product, the product that most people are aware of. And we segmented it on a regional basis, because we knew that in some areas, for example, London, where there was a high vacancy number, but there's also a huge amount of people here, we could rely on our organic traffic as well as our sponsored traffic. Yeah. So you would normally think, let's put the most amount of budget in London, but that didn't necessarily make sense for this campaign, because the vacancy data that NHS England was sharing with us of where the highest amount of positions were for healthcare support workers, there were trusts in London, so we dialed that campaign up to make sure those trusts were getting in a good number of applications. But in South West, for example, they had a shortage, and they had a really collaborative regional team in the South West that really wanted to collaborate and work with us. So we had to do different things there. So what we did was, when I was in my last job running the NHS team as we launched, was we quickly realised that we need to have a different approach for each region. And there's 7 regions within the NHS: North East, North West, East of England, Midlands, South East, South West and London. Yeah. So we had 7 different account managers on those 7 different regions. And then what we also had was 4 national account managers who were also working with the account managers on those regions, with the national team and the regional team. And each national account manager had a couple of regions that they kind of oversaw with the account manager. And it was sharing experience, sharing learning, creating a collaborative approach amongst the trusts within the region, because there's nothing worse than running a sponsored job campaign and competing with a fellow trust.
Oh, yeah.
So you have to be really clever with how you do that to make sure that you're not ending up competing your cost per click bidding against a fellow competitive trust. So there was lots of innovative things we did. And for example, some products in some regions would work better than other regions. And the North Eastern Yorkshire, for example, there's some really rural locations in the North Eastern Yorkshire. And earlier this year, we ran a roadshow with our partners, TMP, who we've worked with on the NHS campaign, and the North Eastern Yorkshire regional team, to get the trust together to have a collaborative shared learning event to say, okay, when we're doing healthcare support worker recruitment, what are we doing to make sure it's a success in some of your really, really secluded areas like Cumbria, for example. And again, there's sometimes where Indeed is not the right method there. There is other areas that they could look at doing. Very much local advertising is really important. But what again is the most important thing is making sure that application to hire is cut down as much as possible, so that person in Cumbria doesn't leave to go and join Costa during the process or Tesco's. And just on that point, while I'm here, and it's just coming to my mind, what was truly unbelievable for me, and I think NHS colleagues throughout this whole 3 years, was, I think it was 3 weeks. It was pitiful. 3 weeks, I think we did it. We clapped for the carers. Was it 3 weeks, 4 weeks we did it? And then it was kind of gone.
Yeah, good point.
And we said thank you to our NHS and thank you to our social care. And then it was, we can't forget about social care. So the MPs are wearing social care badges just to remember them. And it was just, for me, it was so backhanded. What these events showed and what these campaigns on Indeed showed the NHS was how many people wanted to work for the NHS and help the NHS.
Yeah, that's awesome.
And I called it the halo effect.
Nice.
Like, there's not many other organisations where you could run an event across 2 days at Manchester or Old Trafford, and on the second day at 5 o'clock be turning people away and giving them a QR code to follow up with us. Like, where nearly 2,000 people turn up across 2 days. Like, it was truly phenomenal. And it really, for me, demonstrated what a wonderful organisation the NHS is, and us as people living in this country should be so proud of our National Health Service, because other countries look at us with envy, because we have got a hugely wonderful organisation, and the people that work there genuinely are the most inspiring and passionate people that I know. that are willing to go that extra mile to ensure that patient care is given, and that people are supported in the best possible way. And for me, truly, I will never ever forget what a wonderful 3 years it's been working with the NHS colleagues that I've worked with. And that sounds really cheesy.
No, it's great.
But
it's absolutely spot on.
It's 100% true. Like all the way from the chief nurse, Ruth May, all the way down to a Band 2 healthcare support worker who has got a role through an Indeed hiring event that's now been promoted to a trainee nurse associate, and they're on their way in the path to becoming a Band 5 nurse. Each one of those people that I've dealt with, they all share the same value. That is, they are so deeply passionate about the National Health Service.
I completely empathise with that. So when I first got my job at Signet Healthcare, so I had resource, and I went to visit, I live up north, and I went to visit a small home in Southampton. And to be honest, I got there, got a bit of a bollocking from the home manager. I'd only just got my job, but it was recruitment's fault, as it always is. And a bit like, anyway, that was the first bit, and then we got a tour of the home, and it was all the kids with autism, or young adults with autism. Really interesting characters. One of them, I'll never forget, who spins round to the left everywhere he goes, and another one, as soon as there's a door open, he's out the door, close off in the next door neighbour's swimming pool, and it was just a bit of a thing, and the neighbours were cool with it. Anyway, it was I won't say it was chaos, but for me, that was the first site I'd visited. It felt like chaos, mayhem. I didn't feel uncomfortable, and the reason I didn't feel uncomfortable because the people who were working there, two things. One is they just reminded me of my next door neighbours where I grew up on the Manchester Overspill. The second thing is they were genuine, real. And I drove from Southampton 5 hours home like that, just thinking, I'm just going to get you fully staffed. I don't care what it takes, I'm going to get you fully staffed. And it's infectious, isn't it? And it's like, and I suppose part of when we were doing the opening of our podcast this morning, right? So it was driven by the same kind of thing where it's just like, I've always just wanted to be able to create a platform and to inspire change and try and do something. And this is why I'm loving this conversation. I'm not even letting you speak.
No, it's great. No.
One thing that I want to just say before we do run out of time is I feel the opportunity for health and social care at that entry level role in the UK is to open up to outside the sector. You talked about before, and I think that whilst you're here, one of the amazing takeaway for people is how can they use the biggest platform there is to do that, because a lot of people, you've heard it before, fish in the same pool. So if you're just putting an ad on Indeed for care worker, and you're potentially or not just on Indeed, on other media as well, but you're potentially competing with lots of other care companies for the same amount of care workers that are going on, but there's all these other sectors that or people from other walks of life who could be perfect, but unless they're keying in the relevant search, they're not doing it. I know the answer, or I think I know the answer, but I just wanted to put it to you, is that, on Indeed, how can people get the people from all outside the sector?
Various different things you can do. Like, the first thing I would suggest is picking up the phone and having a conversation with your account manager or national account manager. We've got a fantastic team of people that are brilliant at what they do. We have a wonderful client success team who are really passionate about delivering amazing standards for their clients. And we also have various different innovative things we can do. And, through this podcast, I think I've shown it. Like, we utilize the product, and then when it not stop working, but we're still driving numbers, but not as high, we pivoted. That's really important to make sure that the client's getting the best return on investment possible, and the job seekers are being dealt with in the way that they want to be dealt with. Because you see, and the great thing about Indeed being a pay per performance model, and I've worked for the job boards in the past, and if you can't beat them, join them, and that's why I joined Indeed 7 years ago, is the ability to be on pay per performance. So if something's not working, you stop that investment and you understand why, you look at the numbers, and then you maybe look at somewhere else. And then we are constantly looking to disrupt ourselves within our organisation and our products. I'll give you another cheesy quote, but our Chief Revenue Officer, Nolan, who's just recently moved on, is he used to say yesterday's best is not good enough for tomorrow's Indeed. And that's something that we still live by as an organisation. And we have to constantly challenge ourselves. And that means we also have to constantly challenge our clients.
Yeah.
So in summary, if a client wants to look at doing things differently, it's come in with an open mind to have that open conversation.
Yeah.
And we can then collaborate with that client to come up with some really innovative ways to do that. Like, for example, the education zone for those NHS events, it's not a groundbreaking, like, oh my God, people aren't going to be watching this or listening to this and think, why did we not think of that? Because I'm sure it happens, but people could be doing it more, and they could be, and then it all depends on what that education zone's like on the day. If you've got somebody sat on a stand on their laptop not being very engaging or approaching, that's not a great candidate experience.
Totally, yeah.
Whereas, you know, we had trust colleagues who were turning up in their uniform, showing, you know, their name badges, going up and saying, hey, how are you? Like, what would you like to find out about today? That delivers a great candidate experience.
Massively.
And it's something very different with that human element and human touch.
I think that, the partnership approach, you know, yourselves, the event company, with the NHS and the rest of it, it does take it. Well, it's so much stronger with a team, and everybody specialises in what they do best and adding to it to make that candidate experience happen. And so the last thing I'd just say, we had a guest on before, Simon Barrow, who's the godfather of employer brand management. And I know that, you know, one of the ways using your platform to reach other pools of talent is through the employer brand products. So using, you know, the things that Simon was talking about before, plus your employer brand products, which people can obviously find if they speak to the right person, you know, their account managers, etc. But I do see that as being the opportunity for health and social care.
Definitely.
Because so many companies don't do it.
I think it's actually what you say is great, because it's the reason we've kind of come up with this mix of episodes for series 1.
Yeah.
And I think for me, like, we'd like to kind of finish with you know, classic takeaways, but I think there's things we've already talked about, but let's kind of just focus on them a little bit, which is, you know, so the things that people can do when they're going in to work next day, or having that next team meeting, or next month, what they can do next to actually make things happen. Because what you talk about, you absolutely make things happen. It's collaboration. It's maybe not doing things the way they've always been done, and not, you know, and you can argue that maybe there's a bit of staleness in terms of talent attraction, you know, and I've seen that in the care sector. But is that right? You know, and what else do you think people should be thinking about going, right, you know what, I'm going to take it by the horns and really do something differently?
I think the key one for me is disruption.
Yeah.
We have organisations in the, let's say, high volume marketplace that are constantly disrupting how they recruit and how they hire people at scale in a quality way quicker. And it's something, as I said earlier, we all have a duty to do and to look at, because there are absolutely wonderful people out there that display the right values, that maybe don't necessarily have the previous experience and want to work for these organisations. And, you know, there's for me personally nothing worse than seeing a healthcare assistant, as you said, for any kind of care provider on Indeed, and the first thing it says is previous care experience required.
Oh, no. 3 months required.
Yeah.
Why?
What? Come on. Yeah.
And I get your point earlier, what you said about loads of people applying for the roles, just clicking apply. But I think there's a reason why people are now have those behaviours, and those behaviours have come from what we've done as an industry to make it so difficult 100%. To apply for a role.
Yeah, very true. Very true.
And if we were to all get better and change behaviours, then maybe that person that is clicking apply 30 times might not do it, because they'll hear back more from an employer, they'll get more information. And if they're not right for the role, they'll get a nice explanation why, so they don't feel like they should have to apply 7 times in the future and click that to make sure that they get heard, because we want them to be heard. There's nothing worse than being ghosted. I hate it.
And you know, convenience is important. It's like reducing that friction, but not necessarily reducing the rigour. It's just finding the right time to apply that rigour, isn't it? And I think there's so many other parts of life which are more frictionless, and where that element of convenience is important. But I like what you say, because you need that respect both sides. You can't say, oh, candidates have ghosted us, someone's not turned up, when actually the experience they tend to get is, well, I don't hear back from a recruiter. So what you say is absolutely spot on.
It really is, and I think it's going to make me think this, because if you think that at the moment, you know, as a big care organisation, you might get tens of thousands of applications at the moment in the current climate, and sometimes that's, you know, seen as a problem because it's quite hard to get through them all. Lots of duplication, you know, all that kind of stuff. But what you just said there, I don't think it's not a case of, you know, switching something on or switching off. It's a massive learning piece, isn't it, that's needed across the whole sector. Processes that we've talked about today, platforms, targeting, employer brand, the whole thing, which, you know, it comes back to the whole point of this podcast, is that there is a huge opportunity for change, but it's more than just a campaign. It's more than a national campaign or a new slogan or a new thing. It's so an institutional change, isn't it? And that's why, you know, your smile when you talk about your job is you've got a chance to influence that, haven't you? Yeah, which is cool, really cool. It's been speaking to you.
Yeah, thanks.